Okay, hello everyone. Welcome to the Amsterdam UMC. Welcome to this information session about the Master of Medical Informatics. We have a hybrid session, so there are also people at home. Well, so also welcome to you at home. My name is Floris Wiesman, and I'm the program director of the Master Medical Informatics, and I'm also course coordinator, teacher. So yes, I know a lot about the program, and I'm here together with Martijn Siepel, and he's a student. My plan for now is to talk about three things. First, I will explain the field of medical informatics. Then Martijn and I will tell you more about the program. And then finally, I will explain how you can get in our program. First, about the field of medical informatics. In healthcare, there are currently a lot of challenges that we are facing, and I'd like to highlight two of these challenges. The first one is about the aging population. The aging population, a problem in the entire, or almost entire European Union. And currently we see that for each elderly person, there are 3 people working who needs to earn the money to pay the healthcare for this elderly person, and of course also needs to deliver the actual healthcare, so doing the work. And this will get worse for 2050. The expectation is that this will drop to 2 people for every elderly person. So this is of course very difficult. We need to improve the healthcare to keep this sustainable. We cannot have this situation because we will not have enough people providing healthcare and we don't have enough money to pay this. That's one challenge. Another challenge is the challenge of information overload. There is, of course, for healthcare workers need an enormous amount of knowledge to do their work. For instance, if you look at internal medicine, if you look at the number of facts that a doctor needs to learn, it's in the order of 2 million facts. And that is what doctors need to learn during their education. But of course, they need to stay current during their work by reading scientific papers, journal papers. And this number is really staggering. An old study of 2001 said that a doctor needs to read about 20 articles per day to stay up to date, but that was more than 20 years ago. In 2011, it was said that the literature, the scientific literature for healthcare doubles every 19 years. So this is too much. This is too much for healthcare workers, too much for doctors. They need help to get the information that they need at a particular time. So we need to get the right information at the right time to the right person. So these are two challenges in which medical informatics can help. So medical informatics to the rescue. In medical informatics, broadly said, you could say that we're trying to improve healthcare by studying how information is used and how it can be improved by using information systems. So let's have a look at several important topics in medical informatics to give you a more specific idea after this very broad idea. Okay, we want to help healthcare, so that means that we need to find ways to measure the quality of delivered healthcare and to use the results to give advice to improve processes in healthcare. So for that we need quality indicators and we try to improve medical processes. Logistics For instance, we help an ER department to improve the flow of patients through the department in such a way that the patients are helped quickly and we do not have more personnel standing waiting than necessary. Evidence-based medicine is about providing the care to patients that is the best care that we know from scientific literature. How can we do this? How can we provide evidence-based medicine? Well, then we need to get this information, this knowledge to the doctors. It requires medical informatics. The idea of this computer giving advice to the doctor, for instance, by pointing out an important spot on an X-ray or an MRI scan that looks dangerous. That's a part of clinical decision support. And related to that, to find that strange spot on the image, we need to be able to process these images to understand what's going on. So for that, we need image processing. The enormous amounts of data that are available in healthcare, we can use that data. It's the new gold to mine that data and extract relations from the data, and from that draw conclusions. So we need data science and artificial intelligence for that. For all these parts, we need to take into account the laws that are involved. We need to understand how we can make policy and how we can use management techniques to change an organization, to improve it. Then interoperability, that's related to the problem that you are probably aware of, that many information systems are used in healthcare organizations, and it is very difficult to make them talk to each other in such a way that they understand each other. We need to exchange the information between these systems in such a way that the data actually can be used. And that is very difficult because in practice you see that doctors often use one system, they read that what's on the screen of one system and then enter that data in another system. That's of course something what we want to prevent. Usability, user experience is related to the way the user interface is designed of a system. You can imagine if you have a badly designed user interface, that doctors find it difficult to use that system, and even they may make mistakes that can lead to damage to patients. So it is very important to test user interfaces before you actually use them. And our user interface research develops methods to do this testing and design good user interfaces. Telemedicine is about delivering healthcare by using communication over the internet, as we're now doing with the Zoom session, using Zoom sessions to communicate with patients or doctors who are communicating with each other. That sounds like a great idea, but what is the effect on the quality of care that is delivered? How can we pay for this in our healthcare system? These are questions that we also study. And finally, it's not only about doctors and nurses, but also about patients. How can we, for instance, deliver information to patients about their disease in such a way that they actually understand the information and can take action based on that information? Well, these are, as you see, a lot of topics that we address, that we study in medical informatics. There are more. This is, I think, a very good cross-section of the subjects that we study and the subjects that also are present in our program. We look at many levels. So we are not only looking at through a technological view. So we're not only looking at infrastructure and applications that run on that infrastructure, but we are maybe even more interested in the information that is processed by these applications. But to actually improve healthcare, you also need to look at the processes that are governed by that information. And you need to understand what policies are set by organizations or by countries. And of course, also legal limitations that need to be taken into account. So all these levels we have to take into account when we study problems and propose solutions for these problems in medical informatics. But there are also many levels on the organizational side where we're looking. So we look at problems on the, let's say, on the lowest level of the individual doctors, patients, but also departments in hospitals or other healthcare organizations, and higher at entire organizations, a hospital, and even higher the entire healthcare organization in a country, where we not only have, of course, have hospitals, but also general practitioners, ambulances, municipal care, and lots of other stakeholders. And all these parties we take into account. So that makes medical informatics a very broad field. That makes it interesting and difficult, but also very rewarding in the sense that what you're doing actually is meaningful. So this was my short overview of the field of medical informatics. Now I'm moving to our program, the Master Medical Informatics, here at the Amsterdam UMC. Amsterdam UMC has 2 locations, and we are now at the location AMC, and that is the location of our master. And I'll give you an overview of our curriculum, and then later Martijn will tell more about the different courses. But to give you a general idea, it's a 2-year master. Each year consists of 2 semesters. This is the first year, first semester. And we start with a course, current issues. As you can see, every course is prefixed by MAM, stands for Master Module. Because we have very long titles for our courses, we often refer to a course by its number. So we start with 1 course. Then we have 3 courses that are very, very much related. We call them our data science track. Track as in these courses belong together, not that they are optional, but because they're compulsory courses. And then at the end of the semester is a short internship. And in parallel with these 5 courses, there's another course running, and that's the academic skills course. So that's our first semester. The second semester has more or less the same structure, but different courses, of course. We start again with 1 course, Biomedical Information Systems Engineering. Then we have a block of 3 courses that belong together. That's our healthcare management track. That's more the management side of the medical informatics. We finish with an internship, and in parallel, there's again an academic skills course running through the entire semester. That's year 1. Year 2 has fewer details because this year comprises 3 elective courses. So you choose them yourself. We'll tell more about that later. And then at the end, you have a scientific research project where you work on a topic of your own choice. You do research, you write a thesis, and then finally you graduate. So these are our 2 years, it's curriculum of our 2 years. To give you an idea, a better idea of the contents of the topics that our students study, I have taken a few examples of these theses written by our students. We call these the scientific research project. And the first one is about COVID-19. So you can imagine this was during COVID, this scientific research project. And Susanne looked at the throughput of the emergency department and tried to improve the throughput of the patients going through the ER, and did this by doing a simulation. So by using simulation software, she found a better way to get the patients as quickly as possible through the ER. And she did this scientific research project at our hospital at the Department of Zorgsupport. Second project was by Jure Brughuizen, and he did his scientific research project not here in the hospital, but at the company. That's also possible to do your work at the company. And he did a study at mHealth. So that is the use of applications for healthcare that are running on mobile phones. And he investigated factors that influence whether patients will keep using an app or will stop using an app. The third one was by Ines Sikkel, and this was an international project. And she was supposed to go to Ghana, but because of COVID, she had to do her work, unfortunately, here in the Netherlands. And this was about optimizing a process in a fertility care department. And finally, a project by Jiaxu Zhang. She recently finished her SRP, and maybe you've seen her on the promotional video on our website where she tells about her work. And she looked at the log files of MRI scanners because she wanted to predict when an MRI scanner was about to fail. And it's very important to know when an MRI scanner is going to fail, because if you know it beforehand, then you can cancel the appointment with the patient. The patient doesn't have to be sent home, because this happens a lot. And she investigated how she can prevent this by looking at the text in the log files of the MRI scanners. So this was, of course, at the Department of Radiology of the Amsterdam UMC. Okay, these were my examples. Before we continue to Martijn, just a short note about Universiteit van Amsterdam. University of Amsterdam is a top 100 university in the Times Higher Education rankings, in the QS rankings, and in the Leiden ranking. And our program, Medical Informatics, was the best IT master in the Netherlands in the Keuzegids Masters of 2022. Every 5 or 6 years, we set out a questionnaire amongst our alumni, and we asked them a lot of questions on the value of the program for them and for their work. And here are a few results. We asked how long they, after they graduated, had to search for a position, and the answer was, for the majority, said they didn't have to search for a position because they already had one when they graduated. So it's really easy to find a job, and not only to find a job, but to find a job that is relevant for what you have learned. And we asked, where are you working or where will you be working? Most of them, 74%, are working for a boss. Some of them, a very small amount, is entrepreneur or still a student or PhD candidate. But most of our alumni work for a boss. And what do they do? Well, most of them end up in healthcare related IT, several as researchers doing a PhD, for instance, working in healthcare but not in IT healthcare, or working in IT but not in IT healthcare. But that's a really a much smaller group, or they are in education. And I think these numbers are the healthcare related IT, 51%. I think these are higher for students who graduated only a short time ago, because this is, we sent this questionnaire to all our alumni, so also people who graduated 20 years ago. 20 years ago, there were not many jobs in our field. They are now. And we asked, what is your function? And that was a very diverse result, many different functions. Consultants in medical IT is one that we often hear, but with 16%, not the majority. Manager, any kind of manager, project manager, system architect, researcher, but also software developers, information managers, clinical informatician, a large variety of jobs. So key points about medical informatics are that it combines IT, healthcare, and organizational research. We have great career perspectives. We have a great faculty who do the teaching, and we are a very small program. So that means a lot of individual attention that we can give to you as students. And finally, yes, it's in the great city of Amsterdam. Okay, we are not in the center, that's true. We're not near the city center, but still it is Amsterdam. Let's go to perspective from students. Martijn.
Yes.
Yeah,
great. Well, welcome everyone. Very good to see you all here online, and also welcome to those in the Zoom. My name is Martijn Siepel. I'm 22 years old, and I'm currently in my second year of the Master in Medical Informatics. Before this, I studied the Bachelor Medical Informatics, which is also taught here at the AMC. Can I get you? And I'm currently finishing up the master, so I'm working on my thesis. And after that, in 2 months, I will be starting a PhD, also here in the AMC, that's the Department of Internal Medicine, where I will be researching machine learning techniques to improve antimicrobial stewardship, which I'm really looking forward to. And now I'll take you through the courses and tell you some things I really liked and some more detail. But first, as you might have noticed, for those here in the room, you're not in any ordinary university building. You're in a hospital, which is very apparent if you walk. Well, now you can't see it here in the lecture room, but there's actually many patients here in the hospital because the AMC primary function is treating patients as a highly specific, giving highly specific care. But besides the Master Medical Informatics, we also teach the Bachelor Medical Informatics and Medicine, and some smaller courses. The AMC has about 1,100 beds and 7,000 people work here. So it's actually a really large organization. So about the structure, Floris mentioned a little bit about this as well. So we have short courses, 4 weeks each, where you focus your full attention on one course at a time, which really allows you to really delve deep and focus completely on one course. And these courses are often 6 EC. We don't work too often with big exams at the end of a course. You almost never have only one grade in a course. Often you have either weekly assignments or at least 1 or 2 assignments where you really put your skills to practice, and presentations. We do a lot of presentations to explain your knowledge to your peers, and really get you comfortable in front of a screen. The timetable mostly consists of having lectures on Mondays and Fridays, where the Monday lectures are a bit more introductory for a specific subject. Then you have the middle of the week to work on that subject. And then on Friday, you have lectures which are a bit more in depth and really apply the knowledge you've gained throughout the week. And if you look at it, so this is an actual screenshot of a timetable. So only Mondays and Fridays. But as you'll see, especially for example, the first Monday, which was the introductory to the whole course, they can be a bit full. So expect sometimes a bit longer days on those Mondays and Fridays. But the rest of the week, you're free to do whatever, to work, of course, on your coursework. But also if you have a job or working at some company, you have in theory time for that.
True, but it's a full-time program, so you can work as much as you like, but you still have to study. And I expect you to work 42 hours a week, because that's the standard from the Universiteit van Amsterdam.
Yes. This is yours.
Oh yes, that's my yes. So Martijn will tell about the courses, but this course is a new course that we will start giving this September. So Martijn doesn't know it yet. We will start with the course Current Issues in Medical Informatics and AI. And the idea is that we will look at generative AI. So that is AI such as we see in ChatGPT or BART. And these systems, we will look at them from various angles. So we'll look at the technical side, how do they work, and for what are they used in healthcare, or will they be used in healthcare, but also from the view from ethics and security and law and sustainability, because they use a lot of current and produce a lot of CO2. And of course, how to use them in a professional context, and how to use them as a student. So you missed that course.
Yes, too bad, unfortunately. I did have these for you, however. The data science courses. So there's consistent 3 courses, all of which have a different take on data science applications. So the first one, fundamentals of data science in medicine, really focus on statistics and how you do that. And also, if you see statistics, for example, in a paper, because you have to read a lot of papers, of course, how exactly does that work? And what I really liked about this course, and also the second course, Advanced Data Analysis in Medicine, is that we have weekly assignments. So every week you focus on a different context, a different setting, and you work a real cases, which often the professor that's teaching the courses has worked on them themselves. So they really teach you from experience. And any questions that you think are related, but not necessarily part of the course, for example, they often have experience with that as well, which is really nice, and also allows you to have 4 grades in one course. So if one assignment didn't go very well or whatever, it's not the biggest problem. And then there's data-driven decision making and evaluation in medicine, which is also a course that really focuses on the uses of data. And in this course, you can choose one of 3 projects. For example, myself, my group and we worked on implementing a clinical decision support system into a real working application for general practitioners, which basically meant we took a guideline of how you should give care to someone with heart problems. And we implemented clinical rules which could assist a doctor, for example, in prescribing medicine. The system could say, oh no, you shouldn't do this because this patient has other disease X, which might give problems with this prescription. Then after these 3 courses, you do the short internships. which is often 4 weeks. And the nice thing about these internships is you can really have a lot of input in what you want to do. So if you really like working with data or doing a bit more technical, so programming something, you're allowed to do that. But if you're more like qualitative research and want to do literature review or interviews, that's also fine. And at the end of those 4 weeks, you have to write a research paper. And for myself, I did combined internship. So I actually did 8 weeks of internship. So also combining with the second one, which I'll tell you a little bit about more later. And I did, this is the title. So exploring the UMLS, which is an ontology. Semantic network as a mapping ontology for neural back decision trees, which is research in the field of explainable AI, which I really liked at the time, and I still do. So I just asked the professor, are you working on something? Yes, I am. Can I help you? Sure. And we worked together on this project.
What is explainable AI?
Explainable AI is the field of creating AI models in such a way that they can explain what they're doing. And especially in healthcare, this is really important because imagine you have a system which predicts that a patient should receive medicine X instead of medicine Y. And then something goes wrong with the patient. You have to be able to see where you went wrong. But even if it doesn't go wrong, you still have to gain the trust of the doctor and the patient that a model is good enough and trustworthy. It's the most important part to be able to tell a patient or a doctor what to do or what to take. That's the field of explainable AI. Then after that internship, you take another course.
That's mine.
That's actually Floris.
Yeah, it's my course. And it's actually running these weeks. Biomedical Information Systems Engineering, quite a lot of words. And we look at how to build large systems in healthcare organizations. And we do that from a technical standpoint. We look at technologies that are used, for instance, microservices, cloud computing. But we also look at how can you assess a technology for its applicability. So we have here the technology of microservices. Is it a good idea to use this technology in this particular setting in healthcare? And how do we do this? We do this by looking at the literature of the particular technology, but also by trying it out ourselves. So the students are divided into groups and they do a literature study, but they also program a prototype in which they use the technology and try it out and see for themselves how well or how badly it works.
Yeah, for example, my group and I, we designed a progressive web app, which is basically a website which you can download as an offline application on your phone, which could be used by physicians to structurally record data by speaking into the phone. So speech to text and then recording that, which also worked offline, which was a really nice course, especially if you like programming. Not a necessity, but if you do like it, this is one of the courses that really get you going. At least for me, it was. After that course, you have the 3 courses regarding a bit more of the management side. So organizational settings and innovations for sustainable healthcare, which is all about sustainability, reusing equipment, for example, and why we want to or should do that. And what is really nice about this course is we had many guest lectures of people actually working in this field or researching this field who could really speak from experience, give very good examples of why this is so important. Then there's healthcare logistics, which is a bit more mathematical take on optimizing healthcare. So for example, how can you leverage queuing theory to minimize the waiting time for an MRI scanner? How should you let your patients come into the waiting room? And how many MRI scanners do you actually need with a certain waiting time, for example? And then lastly, there's healthcare management, which focus on the management side. So what is a CIO in a hospital or CMIO, Chief Medical Information Officer? Why do you need one? How do you talk to stakeholders? And what's really nice about this course is that you also have parallel the academic skills course. And for example, you teach how to do a consultancy meeting regarding the project that you're doing in these courses, or how do you pitch an idea? That's really nice about these courses. And then then you have a second internship, which I actually did not do because I did one of 8 weeks instead of 2 or 4 weeks. But it's very similar to the first one. You get to choose your own topic. You do a research, but this time it's not necessarily scientific and does not result in a scientific paper, but in a management report, as well as a presentation. Yeah, and as I mentioned, these are some things you have to do in parallel to the other courses. So in the first half of the year, you write a scientific article and an opinion piece, which really flows very well with the rest of the courses. And then in the second half of the year, you do a pitch to a board, which actually consists of people you don't really know, and they really make it as real as possible. For example, we had Jan-Erik Slot at our pitches, who is a real CAO, CMIO of multiple healthcare organizations. And then you also write an advice report, which also really tests your skills in this area, which is really nice because quite a lot of people who do medical informatics, as Floris mentioned earlier, go into consultancy. This really gives you a good idea of how all of that works. And then there are the electives.
Second year, is that?
Yes, yep. This is the second year. So there are 2 tracks. I did the AI for Health track, which consists of 4 parts. You first have an AI brush-up course, because the elective is very heavy on the AI, and not everyone has the same technical background. We have a sort of brush-up course, which just sets everyone at the same level.
Because you follow the courses together with students of the AI masters of the UvA and the VU universities.
Exactly.
Yep.
And then there's the 3 courses, AI for medical imaging, which really focus on image processing. For example, we did a project where we had to recognize ocular disease, pictures of eyes. This one's being taught at the UvA, so not in this building, but at Science Park. Then there's medical AI, which is taught here in the AMC, which also focuses on image processing, but also a bit on language processing. So, and then lastly, there's machine learning and reasoning for health, which is also a project-based AI course at the VU, which focus on leveraging structured information.
Well, you see, since you didn't follow the other track, of course, let me explain the other track, Sustainable eHealth Solutions. A track of 3 courses. The first one is about user experience research, where we evaluate user interfaces to see if they are well designed and that users can actually use them for their work. The second one is health technology assessment, where we look how you can evaluate systems. So now we have a system. Is it really as good as it is supposed to be? And what are the effects? What is the impact on the organization where they are used? And finally, Green Lean Healthcare is about sustainability issues in healthcare. In that course, we visit several departments in the hospital and help them to make them more sustainable. And these 3 courses are taught in collaboration with our new eHealth lab. So that's a lab that we have where we have cameras and eye trackers and microphones so that we can put our test subjects behind the computer, give them a task and see how they are performing this task. And we're not only looking at their mouse movements, but also for instance, at their eye movements, so that we can really see what's happening, well, almost inside the head of our test subjects. And the third option, Martijn?
Yeah, that's actually if you like something else or you want a combination of multiple subjects, you can also choose your own electives at the UvA, the VU, or any other university. You have to apply for this, and if they're relevant enough, there's often a lot you can do if you discuss it properly with with those responsible.
Yeah, and I should add that this option is the only option if you choose to start the master in February, because you can start in September and February, but only if you start in September, you can follow our 2 elective tracks. If you start this in February, you must follow other courses. It's important to note.
Yeah, and then to end your second year, you do your scientific research project or your SRP, which is what I'm currently doing. And just really shortly about my SRP, I'm working with PALGA, which is a Dutch pathology organization who collect all pathology data in the Netherlands for research purposes. And whenever they get pathology data, it always consists of multiple parts, one of which a conclusion text, in which a pathologist just mentions what he or she has done, what's the conclusion and what tissue they used, etc. And to do research on this, you have to know what these conclusion texts are about. And you have a small tool for that, which adds a specific determined set of terms to each conclusion, which sort of summarizes that conclusion very shortly. However, this tool doesn't work very good, and to do it manually it takes a lot of time, which is really an issue in healthcare in general, having to do manual labor. So what I'm doing is I'm training AI models, transformer models, the same ones behind ChatGPT or Google Bard or Gemini since last week, to train a model to do this automatically, basically. So I feed it a lot of, simply put, feed a lot of examples, and then it can do it automatically if all goes well. Currently it's going quite good. And this is in the field of natural language processing, which is one of the parts of the AI track. So if you like that, this is one of those SRPs.
Okay, that's for me. So that concludes our second part. And now I move to the third part. If you think, okay, this is a master for me, what is the next step? Well, first you have to, there are some requirements that you have to fulfill. So either you must have completed the Bachelor of Medische Informatiekunde. Well, none of you has, because then I would know you. And then the alternative is that you have some other relevant education. And what is relevant if there is any connection whatsoever with the field of medical informatics? So it could be medicine, it could be computer science, it could be anything except violin playing almost. But if if your education is very much related to our field, then you can get, the more it is related, the more exemptions you can get for our pre-master program, because you also then need to complete a pre-master program. And if you are a non-Dutch, non-native English speaker, you also need to pass an English proficiency test. The pre-master program, there are two possibilities. If you decide really, really quickly and you are in a hurry, then you can follow this direction. That means if you register before March 1, then this is an option for you. And you must then be a student who is from the Netherlands or from the European Economic, one of the European countries. And you have a good bachelor, then you can start our pre-master program this September 24. And in that case, your pre-master consists of self-study, and you will get literature, you will get video lectures, you will get access to a digital library, and you will get, if you like, you can contact a teacher when you have questions, and you make your exams here at the AMC. Each month you can do the exams that you choose to make. But you will get some exemptions based on your previous studies. If you would have no exemptions, you would pay 1,200 euros. And the more exemptions you have, the less you pay. If you want to do this, contact our email address, premasterme@amsterdam-umc.nl, as quickly as possible, and then we can get you into the program quickly. I think I made a mistake. I said then you can start the pre-master in September. No, you can start the master in September 24. So if you register really quickly, you could rush through the pre-master and start the master in September 24. And if you would have no exemptions, then it comprises 30 ECTS, the study loans. At the end of the pre-master, you get an admission certificate for the master, but it is quite a lot of work, a lot of self-study, especially the version on the left, so don't underestimate that. The alternative, probably for most students, is this option. So this is how it will go from after March 1. Then we have different deadlines. So to start the pre-master, you must register no later than 15 May if you're from Europe. And if you're from outside Europe, no later than March 1. To start with the pre-master. But in this case, you do not only have self-study, but there are also contact hours. About one full day per week, there are contact hours. You will come here to the AMC and you will have lectures and practicals and the possibility to talk directly to teachers. And it costs 1,265 euros, independent of the number of exemptions that you have. So it's always the same amount of money. What is the pre-master about? Well, the topics that were addressed in our bachelor program and that we think are important for the master. I will not go through all of them, but you could say there are basically 3 groups of topics. The first one are the, let's say, more computer science side of topics with mathematics and computer science and programming in Python and R and statistics. The second group are the, let's say, real medical informatics topics, and you will probably not have any exemptions there about medical record keeping and medical images processing. And the last group are the medical topics, basics of medicine and organization of healthcare. So if you did have a medical background, you will probably have for these courses exemptions. And then finally, there are academic skills, and hopefully you already acquired them in your earlier studies. But to get you all on the same level, we included them in the pre-master. So that's the content of the pre-master. If you want to know more about the pre-master, please contact this email address. Could you take the text of this slide and put it in the chat, please, for the people at home? And I think you got some handout maybe on paper, or then you will get it later probably. And then you can get these links. If you want to know more about the master, of course, we have information on the website of the Universiteit van Amsterdam. Our course catalog, that's the course catalog from the current year. The one for next year is not finished yet. And if you'd like to browse through more of the thesis, the master theses of our students, you can find them at the library of the University of Amsterdam. So that's the end of our slides. And we have time for questions. And I'm first looking here in the lecture room for questions after we go to the people at home. If you have a question, you can press the button to talk in the microphone. Yep.
Yeah, I had a question about the application process. So if you want to start the pre-master in September, do we send an email to the email address or do we apply on StudyLink?
It's best to send an email and then we can get it moving faster.
Okay.
Yeah.
Thank you.
Yeah. No, if you completed, the question was, is it possible that you are rejected after doing the pre-master? No, if you have completed the pre-master, then you are automatically admitted to the master program. Yep. The selection procedure, so you have to show what your previous studies were. You have to write a letter where you explain why you want to do this master. And if your motivation is not good enough, then we may say, well, please go somewhere else. But I mean, if you did a good bachelor or anything else before our master that is in a direction more or less of our master, and you have a good letter, then we will let you in, of course. Or do you want to share what your previous education is so that I can already say something about it, or maybe after the session, if you like, and we can talk about it. I see you were hesitating. Okay, we'll talk after the session. Yeah.
I was wondering if you were to start the pre-master soon, so you can start the master in September, you'd pay around 1,200. If you didn't make it before September, would you need to pay 1,200 again to do the full pre-master after that?
I'm not sure whether we thought about this. What happens if you don't make it? Let me think. Now, if we admit you for let's say this fast track, then if you don't make it in time, I think you have, for this old program, you have, I think, even 2 years the time to complete it. And I think you just pay for let's say for the ECs, the ECTS that you do. So no, you pay it once.
Okay, thank you.
Other questions from here? Oh, yes.
Sorry, maybe we can go back one slide to the pre-master slides. Oh,
this one?
Yeah, this one. I was just really confused about the second option. Is that apply the 15th of May to start the pre-master the 1st of September, or start the master?
I agree. This is slightly confusing. 15 May to start the pre-master in September, so that means that you start the master in February 25.
Okay. Yeah.
Yeah.
Okay, thank you.
Any other questions here? Then let's see, are there any questions at home?
Yes, there are 2 questions at home.
Okay.
3 right now. Ooh, wait. First is it possible to spread the pre-master to 1 year? I'm also working and I'm not sure if I'm able to study full time.
No, the idea is that you really do it in 6 months. And the reason is, of course, that it's also the case for the master that it is full time. So that's why we also have the pre-master full time.
Then another question, do you think it's possible to keep a job beside the master's course?
Is there anybody who has a side job for time?
Yeah, from experience, almost everyone. If you study medical informatics, there's a couple of companies who really actively hire medical informatics students. So even if you do not have a job when you start the master, most people do choose to have one during. You'll be more busy, but technically it's possible, yes.
So you can also have a better job than flipping burgers at McDonald's.
Yes, I would definitely quit your old job when you start this master.
Yeah.
And then the other question, what is meant by the reference letter for the application of the pre-master?
The reference letter. Yeah, so you not only you have to explain why you want to enter our master, but you also have to provide some reference. For instance, a teacher from a previous education who can we can contact and ask whether you are really a serious student. But to know more about this, you will hear more about this when you contact our email address, and then they will talk you through what is required.
Then there's another question. How's the job market for students who do not yet speak Dutch or trying to speak Dutch?
Difficult question. If you look at jobs like consultants, then that's difficult because often you go to a Dutch healthcare company and you have to talk to lots of different people in the organization, and then you really need to know Dutch. If you're more interested in a job like, let's say, a software developer or doing research, then it's no problem if you don't speak Dutch. Do you agree, or can you add?
Yeah, I mostly agree. I have to say that the largest companies, I guess, that most medical informatics people go to, those are primarily Dutch. So for example, if you have Furore or Chipsol, which are two really big Dutch companies, those are primarily Dutch. I don't think they hire many non-Dutch people.
Yeah, but that's of course because they really focus on these jobs where you really need to
they implement stuff in Dutch hospitals, so for them it's really important that you speak Dutch. Yep. But for the whole scientific community, for example, is English or is not Dutch. So.
Yep.
That's it for now.
Okay, if there are no more questions from the if you it used to be not the case as far as I know, but now that we have our new program, which is really part of the UvA, I think it is. I know at least for sure that it is true for people from abroad who can get in their country money. And that used to be not the case, but it's not the case now. Basisbeurs, I guess so, but I'm not sure. I will have to find that out. Thank you. Was that the last question? No, not yet.
Yeah. Also for the application for the pre-master, I saw that we have to send in certified copies of our certificates and email, not just email, but also send it physically to the EMC. Is that correct?
Yes, the Universiteit van Amsterdam will check them. Yep, that's correct. Okay, then I think we're at the end. Thank you all for coming. Thank you for your attention and good luck with your choice. Goodbye.